My name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफ़ी फर्क आ रहा है.
Okay. I actually had this surgery in the back and
you said, I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Sean. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Rehabilitation,
and I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
just you try to say something.
treatment the same day. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar, Voice Therapist, and today we are before treatment live with Muhannad Al, and he is not in India, he is in different country, and today date is 24 June 2022, and I am SLP Sanjay Kumar. SLP means Speech Language Pathologist, and I'm an audiologist also. I have done my Bachelor of Science Honours in Speech and Hearing Science from AIIMS Delhi, from All India Institute of Medical Science New Delhi, and Master of Science in Speech Language Pathology from the University of Mysore. And my passion is to create awareness about the communication disorder, and today we are going to talk about the problem puberphonia, and you will be listening the patient voice also before treatment how it is, and in the future we are going to do post-treatment live. And please subscribe our YouTube channel and press the bell icon so that you can watch the Muhammad post-treatment live as well. नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर। और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं मुहन्नद अल बिलताजी के साथ, और इनकी एज है 18 ईयर्स एंड टुडे डेट इज 24 जून 2022। और हम भविष्य में ट्रीटमेंट के बाद भी लाइव होंगे, और इस लाइव में आपको बहुत सारी चीज़ें सुनने को मिलेंगी। और पहला है कि आप इनकी आवाज़ को सुनेंगे कि कैसी है इनकी आवाज़ ट्रीटमेंट से पहले, और प्यूबरफोनिया के केस में आवाज़ कैसी होती है, जो कि एक वॉइस डिसऑर्डर कॉमन है, प्यूबर्टी के टाइम में होता है। बहुत कॉमन तो नहीं कर सकते हैं, लेकिन हाँ प्यूबर्टी के टाइम में होने वाला कॉमन प्रॉब्लम है, लेकिन डिसऑर्डर एक रेयर डिसऑर्डर है। और इसके साथ हम लोग ये भी चर्चा करेंगे कि प्यूबरफोनिया होती क्यों है, इसके सिम्टम्स क्या होते हैं, इसमें के ट्रीटमेंट में हम लोग करते क्या है, नॉर्मल स्पीच प्रोडक्शन का मैकेनिज्म क्या है, और हम लोग इसमें भी चर्चा करेंगे कि वोकल एब्यूज़ किसे कहते हैं और वोकल हाइजीन क्या है। इन सारी बातों पे भी हम लोग चर्चा करेंगे, तो आप लोग जुड़े रहिए। सबसे पहले आवाज़ सुनिए मोहम्मद अल बिलताजी के। सो मुहन्नद, प्लीज टेल अस व्हाट एग्जैक्टली प्रॉब्लम यू आर फेसिंग। अनम्यूट योर माइक, व्हाई यू कॉन्टेक्टेड अस, वेयर यू स्टे।
Hello, my name is Muhannad. I'm 18 years old. I live in Qatar, and I've been suffering from this problem, puberphonia, for maybe 5 years, and I just decided that to seek treatment because I'm not satisfied with the way I'm living right now, like with my voice.
Okay. Have you tried any treatment before contacting us?
No, it's my first time.
Okay. So thank you for contacting, and I'm in Bangalore, India, and you are in different country, Qatar. You are, no? And in spite of that, you have shown faith on me. So we'll correct this problem. Don't worry. And we'll be correcting your problem by online voice therapy only. Okay. So now you can mute your mic, and I'll be talking about some information. So I'll be talking about the puberphonia. So during puberty, what happened? The mass of the vocal cord, length of the vocal cord increases due to a hormone called testosterone in case of boys. So the pitch reduces. And to understand in more detail, let's first understand the normal speech production mechanism. For normal speech production, first thing is the thought that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. Vocal cords start moving like a string of a violin and guitar, and sounds generate. Then we modify that sound into different sound with the help of our articulators like lips, tongue, jaw, teeth, palate. For example, when you want to say paw, both the lips will be coming closer together and touching each other. When you want to say tongue will come between the teeth. When you want to say back of the tongue is getting elevated and touching the soft palate. So each and every sound has own place, own manner of articulation. So when you say a one sentence, there's so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cords move, sounds generate, we modify that sound into different sound. In one sentence, there are so many words. In each word, there are so many sound, and each sound has own place, own manner of articulation. So it is a little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles grows, fluency goes. That can be seen in case of a stammering. If the place of articulation and manner of articulation is wrong, there will be pronunciation problem. And so just you can imagine when you say a one sentence, so many things are happening at a time. And in that process, there are so many muscles are coordinating in a very effective manner. If coordination will be not be there, there can be a communication problem, which we can see in case of a stammering. And what happened in exactly in the puberphonia? Well, during puberty, vocal cord mass length will increase. Here we have larynx. Inside the larynx, we have two string-like structures known as vocal cords. So before the puberty, the boys or girls, there will be no much difference between the vocal cords. They will be almost having the similar vocal cord. But during puberty, due to the testosterone hormone impact, in case of boys, the vocal cord mass will increase, length will increase. So pitch will reduce. Why the pitch reduces? If you have studied acoustics, there is a one relation called n is equal to 1 by 2L under root T by M. So if any string vibrate, the frequency will depend, or pitch will depend upon the tension of the vibrating string, length of the vibrating string, and the mass per unit length. So before puberty, the vocal cord mass length will be the less, so the pitch will be higher. And during puberty or after puberty, due to the testosterone impact, mass of the vocal cord increases, length of the vocal cord increases, then pitch reduces. For a normal male, the pitch should be between 100 Hz to 150 Hz after puberty. But those who are having a feminine kind of voice or puberphonia symptoms, like their pitch will be more than 150 Hz. And especially when they will call on the phone, the people will say ma'am to them even after puberty. You can understand in a very simple way. Like just think about the guitar. Before puberty, in case of boys, the vocal cords are thin. Means vocal cord is like a thin string of a guitar. But during puberty, the vocal cord mass will increase, length will increase due to the hormone testosterone. So that it will behave like a thick string of a guitar. And when guitar string will be the thick, pitch will be lower. So after seeing to you and depending upon my other evaluation, I don't feel any problem you have in the vocal cords. So why your pitch is still higher? Because your age is now 18 years. Of course, you are in teenage, but the puberty age means 12, 13 years is over. You have crossed that age. Why the pitch is higher? Because from childhood to puberty, you spoke in a high pitch voice, and now your vocal cord is ready to produce the low pitch voice. But because of so many years habit, I can say it's a little bit psychological reason, you are not able to switch on to the new voice. To do that, what you are doing, instead of vibrating whole mass and the whole length of the vocal cord, you are vibrating only thin edges of the vocal cord. So vocal cord is actually thick string-like structure, but behaving like a thin string of a guitar-like structure. And when the guitar string will be the thin, the pitch will be higher. So what I will do as a speech language pathologist and voice therapist, this is the biophysics behind that. Of course, the pitch problem can be occurs due to some other problem also in sulcus vocalis, where nature has not given the sufficient mass and the length of the vocal cord. Sometimes we have seen in the phonatory gap also, and sometime in muscle tension dysphonia also. The proper evaluation is very, very important. Being a professional, sometimes we understand the problem. only by listening the patient's voice, sometimes we will be not be understanding. So in that situation, we suggest certain tests in different communication disorder. And we'll be able to correct your problem by online voice therapy only. And today date is 24th June 2022. And those who are watching this live, please subscribe our YouTube channel and press the bell icon. And don't forget to watch the Muhannad post-treatment live as well. And we'll be doing live after treatment. And then, so I spoke about the puberphonia, signs, symptoms, and what we are going to do in the treatment. I spoke a little bit speech production mechanism. And what are the other services available at our center? To understand that, those who are watching this live, please refer the playlist of our YouTube channel. You will find different communication disorder playlists, and all the playlists will be having pre and post treatment videos. So once you explore our YouTube channel playlist, you will find the playlist of puberphonia, high pitch voice, and stammering, vocal cord paralysis, functional aphonia, functional dysphonia, phonatory gap, sulcus vocalis, spasmodic dysphonia, misarticulation, and even after doing the hearing testing and to the suitable candidate, once we fitted the hearing aid, how communication improves, misarticulation, aphasia that happen after the stroke, you will find the playlist. And that will help you to understand how a certified speech language pathologist and audiologist changes the life of people having communication disorder. So these are the things I wanted to share, and I will talk about what is vocal abuse. So because of the vocal abuse, we develop some voice problems. So once you know the vocal abuse, what it is easier for you to understand how to keep your voice healthy. So shouting is a very good example of vocal abuse, and continuously speaking without pause, without drinking water, it can be a vocal abuse. Smoking is also a kind of vocal abuse that may result into some voice disorder. If you are having some acidity problem in your stomach, so GRD, gastroesophageal reflux disorder, sometime the acid will come to the throat while sleeping and all, and that may damage the vocal cord. So if you have acidity, you just consult your physician to solve the issues. And so these are the few examples. And when we talk like whispering, what is your name? Something like that, we create more stress on the vocal cord. So that can be also considered as a vocal abuse. And taking voice therapy from or doing vocal exercise by help in the supervision of healthcare quacks or by doing the self-treatment also sometimes may damage your voice and vocal cords. Because I have seen some patients. So I consider self-treatment also can be sometime a vocal abuse. So when you have a voice disorder, just try to meet certified professionals, those who are having the valid degree in this field. So for example, my degrees are, I have done my Bachelor of Science Honours from AIIMS Delhi, from All Indian Institute of Medical Science, New Delhi. I have done my Master of Science in Speech Language Pathology field from the University of Mysore. I am registered in the Rehabilitation Council of India. So I have also RCI numbers. If you go to our YouTube channels, any videos, description, you will find all the details. And even you can see my degrees also, just for awareness. So those who will be healthcare quacks, they will not be showing the degrees and all. And this is my bachelor degree. You can see All Indian Institute of Medical Science, New Delhi. And the degree name is Bachelor of Science Honours in Speech and Hearing. And that is the Master of Science in Speech Language Pathology. So similar kind of, when you are trying to take any treatment, any voice therapy, must try to explore the credential of the speech therapist or voice therapist or audiologist. Because sometimes due to the unemployment, some healthcare quacks will be also writing with their name speech therapist, speech language pathologist, and audiologist. So first thing it should come in your mind if you are taking treatment from Indian speech language pathologist, are they registered in the Rehabilitation Council of India or not, RCI? What is the RCI? Not mention the which college they got the degree. So I try to create awareness about the communication disorder, and my passion is to treat the voice disorder and expose the healthcare quacks in our field. And so I was talking about what is vocal abuse and how do you know your voice therapy, speech therapy provider is not a healthcare quack. So already we discussed, and how to keep your voice healthy, that also we are going to talk. So this is the general information. It can be useful for those people who are having the voice problem and those who are not having the voice problem. So drink plenty of water. Water is a very good lubricant. I suggest near about 12 glasses of water in one day. It's a very good idea to keep your voice healthy. And if you are a public speaker or if you are a teacher, so if you are taking continuously classes and also in between, try to take some pause, drink water. So that will help you. Shouting is a kind of vocal abuse. Don't shout. Voice and vocal cord has been given to speak, not for shouting by the nature. And don't smoke. Smoking can sometimes result into the vocal polyp, and that may deteriorate your voice and the vocal cord, because some structure will develop on the vocal cord. So this vocal cord, due to the certain mass, will start vibrating in different frequency, and this will be different frequency. So they will not be in unison. So the voice will be the hoarse, there will be some air escaping, so the voice will be breathy, and the sometimes loudness also get affected. So these are the things I wanted to share. And don't do whispering, my name is Sanjay Kumar, something like that. So this is a kind of vocal abuse. So you should avoid the whispering, and of course doing physical exercise will keep your whole body healthy, including the voice and voice box. So have to do some physical exercise as well, like yoga or jogging or whatever you like. So these are the information I wanted to share. And if some healthcare quacks is spoiling your voice and vocal cords, so where to report, especially for the Indian people I'm telling. The Rehabilitation Council of India is the governing council, like for the Physician Medical Council of India is the governing council. So the same way for Speech Language Pathologist and Audiologist, Rehabilitation Council of India is the governing council. So if some healthcare quack is spoiling your communication problem, so you can report to the RCI, Rehabilitation Council of India, RCI. तो मैं ये बताना चाह रहा था कि कोई झोला छाप किस्म के लोग अगर आपकी वॉइस, वोकल कॉर्ड और कम्युनिकेशन प्रॉब्लम को स्पीच थेरेपी के नाम पे ठगते हैं, तो आप रिहैबिलिटेशन काउंसिल ऑफ इंडिया को रिपोर्ट कर सकते हैं। और असली है या नकली है उसको जानने के लिए आप पता कीजिए, जब भी स्पीच थेरेपी लेने जाते हैं तो आपके स्पीच थेरेपिस्ट जो हैं वो रिहैबिलिटेशन काउंसिल ऑफ इंडिया में रजिस्टर्ड हैं कि नहीं है। अगर रजिस्टर्ड है तो RCI नंबर क्या है, किस ईयर में क्या डिग्री प्राप्त की, कौन से कॉलेज से प्राप्त की, कौन सी यूनिवर्सिटी से उनका कॉलेज एफिलिएटेड था, इन चीज़ों का जांच पड़ताल करके ही स्पीच थेरेपी लीजिए। क्योंकि झोला छाप किस्म के लोग सोशल मीडिया पेज बना करके अपने नाम के आगे स्पीच थेरेपिस्ट भी लगाते हैं आजकल। तो इस तरह से आप डिफ्रेंशिएट कर पाएंगे असली या नकली में। और मैं चाहूँगा कि फिर से एक बार मोहम्मद, प्लीज टेल व्हाट एग्जैक्टली द प्रॉब्लम यू आर फेसिंग, प्लीज टेल अस अगेन, अनम्यूट योर माइक।
Hello. I'm facing the problem puberphonia since puberty, so maybe it's 5 years. And by getting this speech therapy, I hope to solve this problem.
Yes, we'll correct this problem by online voice therapy. And those who are watching this live, please subscribe our YouTube channel and press the bell icon so that once we'll be doing post-treatment live, you can watch that. And thanks Muhannad for coming for live and helping me to create awareness about this kind of problem across the globe. We are not in India, in spite of that we have shown faith on us. So thank you. And those who are having the question, please write in the comment box, and I'll try to give answer in the next live. Today maybe slightly I'm busy. So thank you all for joining and watching us. Thank you so much. Some people has joined. I want to say thank you. Rahul, thank you for joining, and Kalik Maggotra, thank you for joining. Projit Nag saying hello sir, hi Projit, thank you for joining. And Jhaj, thank you for joining, and thank you all for joining and watching us. Thank you all, love you all, and we'll stop this live now.